Hello, I'm Dr. Maurie Markman from City of Hope, and I wanted to present a very interesting analysis, sort of a question that has been asked by many over many years as we begin to see increasingly major impacts in a reduction in the risk of developing cancer. Members of our society with the enormous improvements we've seen in screening, enormous improvements we've seen in prevention efforts, and certainly enormous improvements we've seen in therapy. The paper I'm referring to is recently published in JAMA in 2024, entitled Analysis of Breast Cancer Mortality in the United States, 1975 to 2019. So we're talking about a period of about 45 years. And the question that the authors of this paper, statisticians, modelers asked is, we've seen an enormous reduction in the risk of breast cancer over this period of time. In fact, the number that is put in this figure, in this table, this article was a 58% reduction in breast cancer mortality from 48 per 100,000 women in 1975 to 27 per 100,000 women in 2019. And the question they ask is, what percentage of this reduction was due to screening efforts? What percentage would have been done for what we would call adjuvant therapy? In other words, women who don't have evidence of cancer spread, or we don't know for certain they actually have any evidence of cancer, but they have a high risk of cancer after an initial surgery. And what is percentage of the death rate is due to reduction in the death from metastatic disease that we know about at the time of diagnosis, metastatic cancers or subsequently metastatic cancers. And there was just a modeling study, but the bottom line here is very reasonable numbers to kind of remember. The studies they've done demonstrated that overall, approximately 47%, round that off to about 50% of the mortality reduction was associated with the adjuvant therapy approaches, whether it's hormonal therapy with chemotherapy. Almost 50% of this improvement in survival was due to a variety of adjuvant therapeutic approaches after diagnosis of breast cancer. 29% of the reduction, to round that off to 30% or 25% if you like, was due to the improvement of treatment of metastatic cancer. And approximately 25%, or a quarter of the reduction, was due to screening. Again, modeling, but interesting numbers. Obviously, the conclusion needs to be all three approaches had enormous impact. All of them were of value, and they obviously need to be continued. I encourage you to read this interesting paper, some interesting numbers to ponder, to remember, to explain to friends, colleagues, members of society, legislators who are voting on funding. Enormous impact over the last 45 years due to all of these efforts from so many people. Again, all the way from screening to the treatment of advanced cancers. And I thank you for your attention.